Well, this is how the vaccination campaign is expected to unfold in the coming days. It started in central Gaza at 6 a.m. local time on Sunday. It's expected to run for 9 hours in demarcated areas. More than 2,100 health workers and trained volunteers are operating at hundreds of locations. 300 mobile teams are also assisting with the rollout. After central Gaza, the campaign moves to the south of the Strip before concluding in the north. A second round of vaccinations is scheduled to take place in 4 weeks' time. Let's bring in Saleem Oweis, who's a UNICEF spokesperson for the Middle East and North Africa. He joins us now from Amman. So that's the plan for this vaccination campaign. But are you confident it can succeed in these current conditions?
Well, it all depends on the commitment and implementation on the ground. We are ready. UNICEF, WHO, UNRWA, and partners on the ground are already rolling out, and we're very happy to see that the vaccinations have commenced. But the continuation and the coverage is really linked and dependent on the implementation and the respect of this commitment. And as you said, the commitment is limited to those areas, and it's a localized humanitarian pause for the vaccination. But we hope that this is sufficient to cover the over 600,000 children that need to be vaccinated and to reach the over 90% of coverage to be able to stop polio where it is now.
And if you can't reach that goal?
Well, that's going to be a catastrophic event, a real health catastrophe, because polio, we all know, polio is a highly contagious disease. It's the outcome is really grim. It's either paralysis or death even. And it really, in these contexts in Gaza, crowded as it is, with all the lack of the basic health systems and hygiene supplies and water and all the such, it's gonna prove to be catastrophic, and that's why it's imperative to have it now. And there's no other option other than vaccinations. Polio can't be treated, but can be prevented, and that's where we need to put all the effort now, and that's what we're trying to do, and that's why we really need this to work and this pause commitment to take place.
Of course, whether it works depends on whether or not it's safe enough for people to bring their children to these vaccination centres. That is surely difficult, if not impossible, for many families if they're being, pounded from the sky.
Well, surely that's why we're really looking at the post to allow people to move to those centres. We have 11 main centers across the Strip, and of course mobile teams to go and vaccinate children all around. But that all, again, it all depends on these pauses and the safety and security, not only of our teams, but of course of children and families coming in to receive the vaccine.
How much more effective would this campaign be in the event of a general ceasefire in Gaza that would allow people to get around safely and access what you're offering?
Well, that would be the dream, really. We've been calling for a ceasefire for humanitarian reasons for so long, and it doesn't get any more humanitarian than a polio cases coming up in Gaza in this situation. So really, a ceasefire would make everyone's life just much easier. It will guarantee a full coverage, which we had before the war started, and will just stop it right where it is without any fear of spread. And the fear is not only in Gaza now, the fear is regional. Polio doesn't know borders, so we really need to stop this. We hoped for a ceasefire. It didn't happen, and this is what, and we asked for a 7 days pause, but this is what we have now, and we think with this, if it holds, we can reach out the children and have a good coverage. But we'll see what the days bring, and hopefully we will be able to do our jobs.
Of course, polio is a health catastrophe for Gaza, but there is a major public health crisis in the Strip right now because of the unhygienic conditions that people are living in, overcrowding, polluted water, sewage. What else are you worried about?
Well, exactly what you said. I was in Gaza just recently, and you couldn't visit a family or talk to a person without a relative, a member of the family that is either sick whether it's diarrhea, respiratory system diseases, rashes. You can't see a group of children without at least one or two of them with rashes. It's really dire. The health response is really bad. Going into hospitals, you can see children really just flooding the hallways and being treated there or waiting for treatment that is really not in the hospitals. So that's a real concern. Of course, security and safety in general continues to be a big concern, and unfortunately, with each attack, we see children among the casualties. This needs to stop. Of course, the focus now is on polio and diseases, but the war continues, and children continue to die because of that, and now even because of preventable causes.
Okay, thank you very much, Saleem Oweis, for explaining the situation there for us. Thank you for joining us from UNICEF.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.